Okay, here goes nothing. So I tried filming this video already last week, but when I was watching it back, I felt like I was trying to censor myself a lot so it didn't come across as authentic as I wanted to be. I think it's because I have so many friends and so many people I know in the medical field, and I have a lot of respect for the field, so I didn't want to offend anybody or have anyone take anything in the wrong way. But I decided to just come try it again and just bring my most authentic self. Hi guys, Malika is my name. Welcome back to my channel. If you're not one of my 53 subscribers, then you're new here. As you can tell from the title, I previously studied medicine. I worked as a doctor for a couple of years, and now I've transitioned into the pharmaceutical space about 3 months ago. So I'm just here to share a little bit about my journey and why I decided to make that decision, just in case it might resonate with someone or you might find it relatable. So before we talk about the whole transition, I think it's important for me to maybe touch on my past a little bit so you know how I actually ended up here. For me, I was never one of these people that knew exactly what I wanted to do with my life from the age of 5, right? So when it came that time where I was in Form 6 and I had to choose some kind of a subject to study in university, I knew a few things. So one, I knew I liked science, I was good at science. Two, I knew I really liked helping people. And three, I was a curious person by nature. So when I put all those things together, the only career at the time seemed like medicine. I just wasn't really exposed to many other different career paths, I suppose. And I didn't really do a whole bunch of research into alternative career paths and different things that were available. So my circle, my bubble was very small, and I ended up in medicine. So then I went and I studied. And to be honest with you, the first 2 years I really enjoyed it. Then third year we started doing the clinical bits, and it was a little bit, I still enjoyed it a lot, but it became a little bit more challenging. And that was fine. I was able to cope and adapt because I knew medicine wasn't going to be easy. So I never went into it with the mindset of thinking, oh, this is going to be easy. But I got through that. And then the fourth year came, and that coincided with COVID as well. So I found that year particularly challenging, and it was because a lot of our lectures were based online. There wasn't a whole lot of interaction with patients or with your fellow classmates. It was a very isolating year, and I really started to find medical school quite challenging at that time. And I wasn't particularly sure if it was due to the course content or was it due to the fact that our entire lives had changed. I was just lacking a lot of motivation to really finish the course. But at that stage, I had invested time and money into medical school, so the only thing that made sense was to complete it. So I dragged myself through the fourth year, then I got to final year. And the funny thing about final year was a lot of people would be asking, like doctors would ask you, what do you want to do? What do you want to do with your career? Like, what do you want to specialize in? And my answer would always be, I think I want to become a healthcare consultant or go into pharmaceuticals. And to be fair, I meant it as a joke, just because I didn't really know what I wanted to specialize in. I couldn't give an honest answer. Some people would be like, what? And then some people would laugh about it with me because, I mean, we all know it has its challenges, right? But I decided, even after final med, I just do the internship, which is you go into the hospital, and in Ireland you do 6 months of a medical placement, 6 months of a surgical placement, generally speaking. Some people do other bits, but I did that for two reasons. One, I wanted to see how different life would be as an actual doctor versus as a medical student. And the second reason was because in order to get fully registered on the medical register, you have to complete an internship. So I just thought, look, I've already done 5 years, let me just see it through, do an extra year, see what things are like. I got through the internship. It was very different to being a medical student. I felt like I enjoyed it a bit more, but I still didn't really have any clarity in terms of specializing and where I saw my career going. So I decided I didn't really know what to do next. So I figured, look, I had some kind of interest in the surgical curriculum in medical school when compared to the medicine curriculum. So I decided to do a 1-year contract job in surgery, general surgery. Now, my whole thinking during that time was, okay, during this year I would either decide, look, I want to specialize in this, or I might find something else that I want to specialize in, or the third thing would be I would find an alternative career pathway to go through. Now, as you could imagine, when you're in medicine, it's quite difficult to picture yourself in a different field, because sometimes a lot of us feel like all I have is a medical degree, like who else is going to hire me out there? So yes, I ended up taking the 1-year contract job, and if you watch my unrealistic yearly planning thing, you would see that I was pursuing a few different things at the same time. So anything I had an interest in, I looked into it further. I did a lot of research in terms of alternative careers. So I was on Google, YouTube, LinkedIn, just looking at the profiles of doctors that transitioned out of medicine and into something else. I would be looking at what they studied, what positions they worked at, where they worked, all those kind of bits, right? So I did that. And then I also realized I had an interest in aesthetic medicine. So I pursued that as well. I did a bit more studying in that. So I did my diploma in that during that year. And I was also still trying to involve myself in my job, my surgical job, as much as I can. So I was trying to learn as much as possible. So as you might have gathered, that year for me was about really figuring out what came next. And I was trying out a few different things, right? But at the end of the day, it came down to a few things. So in medicine, when you work in the hospital, a lot of people are coming into you with events or diagnoses that would have completely altered the trajectory of their life. And it really forces you to be more introspective, and it makes you it made me really want to maximize my fulfillment in everything that I did and make sure that I was content with everything that I was doing. And ultimately, I didn't feel like I was fully getting that from the career path. And the second reason was because I just felt like I could never imagine myself being in a hospital doing medicine in 5, 10, 15 years time. And I didn't know if maybe that was because I was lacking a bit of passion. So because I'm curious by nature, I thought, okay, maybe I could try something else and see if that might make me feel a bit more passionate, if it would ignite that contentment that I was referring to. And the third reason was because at this particular point in time, I just want a little bit more flexibility in my life, and I don't want my spare time to be dependent on whoever's making the router, right? I don't want that right now. Not to say that I mightn't change my mind in the future. I still keep up to date with my medical training. I still am on the register, and that's because I still have it as an option if I ever wanted to go back. And who knows, I might do a few bits from time to time, but that was the reason why I left it full time. Anyway, thank you so much for watching this all the way to the end. If you found anything relatable, feel free to comment below. If you're working in the medical profession, tell me what your favorite things about the job are, what are your least favorite things about the job, and like and subscribe and come back to my next video. Bye.